To all the struggling ankles out there, you didn't deserve to land on the edge of that giant pad stack. You couldn't have known that the rock on the trail was loose, and you can't be blamed for forgetting how to walk correctly when loaded down with that climbing gear. My dearest ankles, this one's for you. In my practice, I hear all the time how people are still suffering from their ankle injury a year or so later. When you ask them what they did for it, the answer is a solid shrug. If you're proactive in your rehab, you can definitely recover. For that reason, we're going to cover some common causes of lateral and medial ankle injuries for climbers, a bit of testing to determine how severe an injury it is, and finally, how to get those ankles strong again. Note, we will not be covering a syndesmotic, aka high ankle sprain in this video. There are 3 ligaments and 3 muscles that bear the brunt of most ankle injuries. The most important ankle ligaments, in order from most commonly to least commonly injured, are the anterior talofibular ligament, or ATFL, the calcaneofibular ligament, or CFL, and the deltoid ligament. The ATFL and CFL are found on the lateral aspect, or the outside of the ankle, and are involved in an inversion ankle sprain. An inversion ankle sprain is caused by rapid, uncontrolled, excessive inward and possibly downward or pointing of the toes movement of the ankle. This will overstretch the ligaments and produce injury. The ATFL and CFL are more commonly injured because your inward and downward mobility of the ankle is far greater than your outward and upward mobility. The deltoid ligament is actually made up of 4 ligaments and is found on the inside of the ankle. It is involved with an eversion ankle sprain. An eversion ankle sprain is caused by a rapid, uncontrolled, and excessive outward motion of the ankle, while usually in a more neutral position regarding the foot either pointing up or downward. As for the muscles, the ones to be aware of are the peroneals, the anterior tibialis, and the posterior tibialis. These are also the muscles that we will want to work on to restore function after an injury. The peroneals are the most commonly injured with an inversion ankle sprain simply because they try to resist inversion. Meaning, as you're going down and about to suffer that fated ankle sprain, your body tries to activate the peroneals to stop it from happening. This can damage the muscle tissue if the external force is too great for the peroneals to handle. The anterior tibialis is injured in a similar fashion. Its role is dorsiflexion and eversion, so lifting the foot up and out to the side. So if your ankle injury involves inversion and plantar flexion based injury, aka your ankle rolls in and your foot or toes point down, the anterior tibialis could be damaged. Finally, the posterior tibialis is one of the main muscles that holds up the arch of the foot. Its role is plantar flexion and inversion, aka pointing the toes and turning the foot in. If we suffer an eversion or medial ankle sprain, the posterior tib may try and resist this and get damaged in the process. I've put together a little chart to help put all that information into one nice little box. Before we learn about how to test and treat an ankle injury, we should be aware of some of the reasons you may have gotten injured in the first place. When we injure our ankles, a few very important things happen. 1, we lose proprioception in the joint, meaning our body's ability to sense the position and movement of our ankle becomes limited. 2, the muscles supporting the ankle become damaged or weakened, decreasing the natural muscular support system of the ankle. And 3, 1 or more of the ligaments in the ankle get damaged and do not heal back to 100% without intervention. These 3 issues, if not addressed through rehab, will significantly increase your risk of re-injury. General weakness of the foot, ankle, and hip may also contribute to an ankle injury. Our muscles can be the defenders of our ligaments. They can protect the body from moving through excessive ranges, which would cause damage to the ligaments. Weakness in those muscles reduce their ability to function in that role, increasing the risk of suffering an injury. Poor balance is a sign of poor proprioception. If you have poor proprioception, that means that your brain and body may not be communicating effectively. You may notice more like oscillatory movements while attempting to balance. This is the brain and body trying to communicate to determine the optimal joint position and muscle contractility in order to maintain a better center of gravity. The better this communication, and more matter of fact, the quicker this communication can occur, the more capable the brain is at correcting any potential errors in the body, and the less likely you are to suffer an ankle injury. Note, there are other factors that may affect your proprioception, such as a vestibular disorder. If you feel you have a more complicated history with your balance, please see a skilled provider. This is actually a huge risk factor for climbers and something that needs to be particularly emphasized to newer climbers. Proper pad placement is crucial in protecting your ankles, so take note from experienced climbers on how they line up pads. Avoid gaps and stacks and use active spotting. If you've experienced an acute ankle injury, one of the most important first steps is determining if you have just a sprain or if you need further imaging to assess a potential fracture or avulsion injury, which is where a small part of the bone pulls off from the rest of the bone while the ligament or tendon remains intact. For this, we use the Ottawa ankle rules. Rule number 1, you must be able to take 4 unassisted steps. A little limp is okay, but you may not use couches, friends, crutches, countertops, or climbing walls for assistance. Rule number 2, your pain isn't welcome here. Well, that is, isn't welcome in very specific regions, which I'll list in a minute. Have a friend poke and prod these 4 areas to test for pain. Have them start with light pressure, stopping if there is pain, and then advancing to moderate or even heavy pressure if each stage is painless. The first 2 regions to check are the big bones protruding from the sides of your ankle. Find the spot where they stick out the most, then move back towards the Achilles about a centimeter. The third region is the base of the 5th metatarsal, which is basically the widest part of your foot on the pinky toe side. The 4th region is the navicular bone, which you'll be able to feel in the arch of your foot. If you could walk 4 unassisted steps and didn't have pain in any of those areas, you pass the test and can be quite certain you don't have an avulsion injury. If you failed either of those tests, you cannot rule out an avulsion fracture and you should consider seeing a skilled practitioner who can order you an X-ray. If you don't have an avulsion injury and want to know how severe your ankle sprain is, then you're in luck, because next we'll discuss testing for severity of an ankle sprain. We're going to do 6 simple tests, then compare our results to this super cool chart so you can see how significant your injury is. Be sure to note what you feel and observe during each test, as well as the location and intensity of pain, none, mild, moderate, or severe. You don't actually want to do anything that causes more than mild pain, but you should be able to infer the intensity by how much or how little force is required to evoke symptoms. You should also compare your results to your opposite leg to see if it is your normal or if it is in fact a symptom. The first is simply observation. This is your no risk, no pain test. We're looking for swelling or discoloration here. The most likely location for swelling would be around the lateral or medial, like the outside or inside, aspects of the ankle. More specifically, centered around the medial and lateral malleoli, the big bony protrusions on either side of your ankle. The next stage is active range of motion. This will involve moving the affected or injured ankle through active dorsiflexion, or pulling the foot and toes up towards the shin, and plantar flexion, or pointing the foot or toes down like a beautiful ballerina. Note, if you have pain on the outside of your ankle with plantar flexion, use caution with the next test. The second phase of the range of motion is much more specific, meaning it will much more likely place strain and/or stress on the potential injured structures. With that in mind, move slowly, move with caution, and stop when you feel an onset of discomfort. Now that we have stared deeply into our ankle sole and tested its range of motion, let's see how it's functioning overall. How is walking, stairs, up or downhill, standing on one leg? Depending on the grade of the sprain you're experiencing, you will experience a varying level of loss of function. The Taylor tilt test is going to help reveal if you have a mild, moderate, or severe lateral ankle sprain. To do this to yourself, cross your affected leg over the unaffected leg with the outside of the calf resting on top of your thigh. Grab the heel or the calcaneus and then lift it straight up. Stop if this causes any pain. If this does not cause pain, continue to pull. You should eventually feel the tissue stop this mobility. Compare your findings to the unaffected side. Special note, with a grade 3 injury, it is possible that you have completely disrupted or torn the ligament. This may produce a pain-free range of motion that is now excessive compared to the other side. While palpation won't likely cause the injury to actually worsen, it may cause some discomfort which will affect the other tests, hence we do this last. Palpation is most important in the locations we just noted in the aforementioned differential diagnosis section. Focus on the medial and lateral malleoli and palpate to see if it produces any pain or discomfort with light to moderate pressure. The anterior droid test is a very common test done for ankle sprains to determine severity. Unfortunately, you can't actually do it to yourself. It has to be done by a skilled practitioner. I'm only including it so you're aware that it exists, and so this video is as comprehensive as possible. In this section, I'll show you a variety of techniques and exercises you can use to heal from an ankle injury. For information on when to perform these and how to organize a rehab schedule, reference the charts at the end of the video or just check out the show notes. Bracing or taping can be an important part of your recovery. Typically, bracing is done in the early stages of recovery to help protect the injured tissue. The ankle is one body part that bracing doesn't seem to have negative long-term effects on, according to research. But even if you are bracing, you should continually move the ankle, as we will discuss in the next component. Research supports that range of motion even in early stages is important to promote healing. You want to stay active and move through multiple ranges of motion. Don't push through pain though. If you have injured tissue, you don't want to overstretch it further, but stay moving. Perform one set of 10 to 20 repetitions multiple times a day, 7 days a week. Unless you have a high-grade ankle injury with a large amount of swelling, I do not recommend NSAIDs or icing. The inflammation you will experience is normal and part of the healing process, so don't slow it down. Note, I'm not your physician, so you can do as you please. I'm not telling you to stop taking your NSAIDs if this is prescribed. Balance training will be one of the most important factors to restore your confidence and function. Balance training can be static or dynamic. Static balance refers to attempting to balance without or with minimal movement. Dynamic balance would be the opposite. You're attempting balance while creating movement. Balance training can also be performed with your eyes open or eyes closed. Eyes closed can be particularly helpful for improving proprioception, as it will force your brain to become more dependent on the feedback it receives from the muscle and joints rather than just depending on your vision. Basic balance is going to focus on static balance, but will use the eyes open and closed balance component. A simple progression will be moving from Romberg stance with feet together, modified tandem, and finally single leg balance. You'll want to be able to master each stage with your eyes open and then with your eyes closed. Perform your balance training at least once a day. 2 times a day will produce faster results. This is okay to perform daily, and you want to be able to perform the hold for 20 to 30 seconds before you consider it mastered. Now, for advanced balance training, we're going to get a little crazier. We're going to incorporate aspects of strength and balance. Advanced balance training will mostly be dynamic, meaning it will promote movement in multiple directions or planes of motion. It will also typically involve changing the surface you use, such as a foam pad, rolled up yoga mat, or a BOSU to help add in additional challenges. Get a foam pad, a folded up yoga mat, pillow, blankie, or BOSU and place it on the ground. Step on the unstable surface with a single leg. With the opposite leg, kick it out to the side. Keep the toes pointing straight forward on both legs. Don't bring the moving leg forward. It should be slightly behind your stationary leg. Place a BOSU dome down, step on it with a single leg and gather your balance. Perform a single leg squat and reach the opposite leg behind you to touch the ground lightly. Return to standing, repeat but reach the leg forward, then to the side, and curtsy across you. Increasing your ankle strength independently from balance training will also be helpful. This will help support the ankle and restore function. Recall, the peroneals and the posterior tibialis are 2 of the more important muscles needed to restore function. Hence, let's get a great exercise for each of those. To perform side steps with a resistance band at your toes, tie a resistance band into a loop or just buy a looped band. Place it around your feet near the toes or the ball of your foot. Create tension in the band and go into a small squat. Take a step to the side, lift the trail leg up and control it as the band tries to force you inward. To perform resisted ankle inversion, tie a loop at the end of a resistance band, place this loop around your foot, step on the band with the unaffected leg, lift the affected leg up and across, placing it the outside of your lower shin on top of the unaffected thigh. The band should now be pulling your foot down towards the ground. Fight the band by pulling your foot up towards the sky while also turning your foot up as if you're trying to look at the bottom of your foot. Slowly allow the foot to lower back down. Perform 3 sets of 10 to 15 repetitions, 1 to 3 times a week. The final stage of your training should involve advanced drills applicable to your sport. In this case, climbing. This is mostly going to focus on jumping and landing, so we have to practice just that. My recommendation is perform a single leg backwards jump. Start on the flat ground standing on one leg. Jump backwards, landing on the same leg. Use a mirror to record yourself to make sure you maintain good shoulder, hip, knee, and ankle alignment. To progress and make this more realistic and functional for climbing, stand on a step or box and jump backwards off of it. Perform 2 to 3 sets of 4 to 6 jumps 1 to 2 times a week. Note, the higher or more intense you make this, the fewer repetitions you want to perform. This is a very challenging exercise and should be done assuming your own personal risk or with the supervision of a skilled professional. There's great news when it comes to ankle injuries. You can absolutely return to your prior level of activity and function without major long-term effects if you follow an effective rehab plan. A grade 1 injury may feel fine in just about 2 weeks. A grade 2 injury may take 4 to 8 weeks to feel better, and a grade 3 can take 3 to even 6 months, but it could honestly even take a full year to restore that strength if you have a severe injury. Be sure to train that single leg balance with your eyes closed so you can climb your slab project while chatting about current events and send the climb without even knowing it's over because your eyes were closed the whole time. Now repeat, but this time just on one leg. Lower extremity injuries account for... This is supposed to be a good day. The anterior drawer test is a very common test done for ankle sprains to determine severity. Come on, maybe I need water. Nothing is worse than punting off the top of the project. To top that off, you injure your ankle while landing awkwardly? Talk about injury on top of insult. So protect those ankles and finish all your projects. The first 2 regions to check are the big brones family.
I'm not fat, I'm just big bro.
I'm just big broned.
Dude, say something cool so they like the videos and subscribe for more awesome content.
Like and subscribe for more super sweet vids, y'all.
So lame, dude. So lame.
I thought it was pretty good.